come on up close. There's very few of us. You'll be able to see better, we'll be able to hear better. There'll be plenty of room for them too. Thank you for coming this afternoon. I'm Rabbi Gordon Fuller, and I stand here before you, as old as I look, as a rookie. I'm a rookie because I'm new to hospice care. I am a part-time rabbi for the Jewish Care and Support Program of Gilchrist Hospice, and I'll explain more about that as we go through. Gilchrist is a nonprofit organization with its corporate headquarters in Hunt Valley, Maryland, serving, as you'll see, primarily the Northern Maryland area. You can see the mission and the vision up there on the screen before you. But what's really important, more than either their mission or vision, is to understand what it is that Gilchrist can provide for us in our community. And those are the three things enumerated at the bottom there: counseling and support, elder Medicare, and hospice care. Elder medical care is primarily geriatric, but it includes all different kinds of places. As you can see, we do them in homes. We also do them in residential community centers, residential community care. That would be places like Harmony House here, Vantage House, different places like that. Integrative and palliative medicine, again at those same two locations. Geriatric consultations, and residential rehab beds. GBMC stands for Greater Baltimore Medical Center. Gilchrist is one of three legs of a stool. The stool is referred to as GBMC, so we have the medical center, which is actually in Towson, as the hospital owned by the nonprofit. Gilchrist, which has the hospice care that we're learning about this afternoon. And the third piece is they actually have an association of physicians that agree to be in practice with each other as the third piece, the third leg of that stool. So I'm going to focus on Gilchrist Hospice. And as you can see, we've got the hospice care, which is done at homes and in our RCCs. We also have our own inpatient units. We have three of those. One is in Towson, not far from GBMC Medical Center. One is right here in Columbia at the end of the street where Harmony House is. And the third is in Baltimore, where the old Memorial Stadium used to be. Gilchrist Kids is actually hospice for children. Hospice is not just for elderly. And the children's unit is at the Baltimore inpatient for Gilchrist. In addition to medical care, we offer counseling and support services. That includes care navigation, making plans that are appropriate for families, grief counseling, obviously after someone passes. We have volunteers who do various kinds of support. We have community education programs such as this one. We have an international partnership with Tanzania in Africa, where we are teaching them about how to care for elderly and end-of-life issues. We have special salutes to veterans. Anyone who is enrolled in Gilchrist and has been a veteran is entitled to, if they so choose, what we call a salute to service. It's a brief service wherever they are living, where we honor their military service, give them a few gifts, and support them there. Music therapy. We have a team of, I believe, 3 musical therapists who are all certified musical therapists and will go around as needed to help patients by using music. And then the one that I'm most familiar with, because it's the one I'm a part of, is Jewish Care and Support. This has actually been newly restructured at Gilchrist. In the olden days, we have chaplains in Gilchrist. And in the past, some of those chaplains were Jewish chaplains, but that has now changed. Chaplains, as you may know, whether they're in hospital settings or hospice settings or wherever they may function, including in the armed forces, Chaplains can be of any religious background and serve anybody who is part of the organization that they work for. What we're doing at Gilchrist with Jewish Care and Support is that we have, if you'll excuse the sports metaphor, we have a bullpen of people like myself. We have two rabbis, myself and Rabbi Ben Shalva, and a cantor Karen Weber. And the three of us are the ones who provide Jewish support to anybody who is a Gilchrist patient in any of the catchment areas that we serve. So they will have a chaplain who likely is not Jewish, and that chaplain will ask them, would you like the services of a Jewish support care person? And if they say yes, we will then step in and attend to their religious and spiritual needs. You can see here the catchment area. As I said, it's primarily northern Maryland. We've just started in Anne Arundel County. That's fairly new. And we don't need to go over the statistics because I want to make sure that we have time for questions that you may have. Hospice is really about providing a model for quality, compassionate care for people facing a life-limiting illness or injury. Focuses on medical care geared towards managing those symptoms, and it has the core belief that each of us has the right to die pain-free and with dignity. The focus is also on family and loved ones so that the survivors can receive spiritual and emotional support as well. In addition to the RCCs, the residential care places that I spoke about before, and the inpatient units that we have, we also provide, and I would even say it's the majority of hospice patients at Gilchrist live in their own homes. And so the teams go to the homes to provide the services that are necessary. You can see the overlap in the diagram there of the four areas. We want every patient to be free of suffering. We want them and their families to achieve life closure. We want them to receive care consistent with their personal beliefs, wishes, and values. And one of the misconceptions, we'll get to some other ones, about hospice care is that we do not either hasten nor prolong the dying process. That's not our function. That's not what we're here for. We use an interdisciplinary team approach, not just religiously, as I've talked about already, but we have physicians, medical directors, registered nurses, hospice aides, social workers, chaplains I talked about, volunteers, including a doula program, bereavement counseling, and musical therapists. All of us together at Gilchrist work as a team to make sure that the needs of individual patients are being taken care of in the way that they would like to have happen. Here's bullet points of all the different kinds of services we provide, which is fairly redundant over the groups that I just mentioned, but I'll leave it up there a second so you can read through it. Here are some of the other myths. Hospice is a place. That's a myth. The fact is that hospice can be provided at any place a patient calls home. Again, all those places that I've talked about before. It's a myth that hospice care is just for the elderly. You heard me mention our children's inpatient unit. There are unfortunately children who have life-threatening illnesses or injuries, in which case hospice can come into play. It's a myth that choosing hospice means that I only have days or hours to live. Okay, hospice care focuses on living as fully as possible until the end, but not just at the end. With one caveat, and the caveat is that to be placed in one of our inpatient units, not to get hospice care in general, but to be placed at one of Gilchrist's, one of those 3 inpatient units, has to have medical approval that it's the appropriate placement for them. That can't be made by the team, it's got to be made by an MD. And then finally, Medicare requires that a patient have a DNR, do not resuscitate, directive. That is not the case. We encourage it because we think it's wise, and we can provide it for those who don't have it. But we can also provide CPR for those who decide that they don't want to have a DNR. Hospice care manages pain using addictive narcotics. That is a myth. Again, the team approach does its best to make sure that pain is dealt with in the most appropriate ways with the most appropriate medicines as needed by the patient. A myth, again, is that the hospice will starve them and stop all of their medications. That's not our goal. That's not how we operate. We want people to live life to the fullest and make individual plans appropriate for them. It's a myth that only those who can afford hospice care are able to access it. That's not the case with Gilchrist. First of all, as a nonprofit, we don't charge anybody anything for our services. Most of our income comes from Medicare reimbursements or other insurance reimbursements, but we do not turn away any patients just because they don't have insurance or can't afford to sign up for hospice. These bullet points are some red flags, some suggestions on when you might consider talking to a place like Gilchrist about whether hospice is appropriate for you or your loved one. Progressive weakening, a decrease in appetite or an unintended weight loss, an increase in pain medications that are needed, multiple comorbidities, if there's a general decline, if there are symptoms that are hard to control or becoming hard to control, if a patient has multiple hospitalizations more than 3 times in 6 months, if someone is dependent on people in the home to help take care of them, if there's shortness of breath even when they are resting, if they are immobile, if they are mostly sitting or lying down and unable to ambulate anywhere, if they're getting recurrent infections, particularly around breathing, aspiration, or pneumonia, and finally, decreased alertness if their consciousness begins to wane. Those are all good times to consider enrolling in hospice care. Medical care, as I said earlier, is before hospice, and so that is elder medical care only, medical care only, and can be provided for those who are interested in it. I'm going to skip through the rest of that because that's not pertinent to hospice care particularly. Music therapy, these are, as I said, certified therapists who use music to help people. Some of you may know that hearing is believed to be the last sense to decline or stop. And so hearing songs that are familiar in languages that are familiar. So for instance, an elderly Jewish patient might benefit from hearing Yiddish songs that might make them feel better, comforted, remind them about things that they're interested in. Also choosing musical tunes that are appropriate to a person's age. If you're interested in touring any of the inpatient units, they're happy to do that for you. So I mentioned the Jewish Care and Support Program. The picture at the bottom right there should remind you, if you've ever been to Israel, of the Western Wall. It's actually made with Jerusalem stone. This is a chapel that was made at our Towson inpatient unit. And there was an elderly man who was quite wealthy, and his family was quite pleased with how Gilchrist took care of him. And he has endowed the Jewish hospice care program, as well as paid for the Jewish chapel space that's at the Towson unit. So we can, in addition to providing the spiritual care as rabbinic and cantorial supports for people, families that want to observe Shabbat or other holidays inpatient can call on us. We can put mezuzot on the doors of any place they live, even if they are institutional settings. We can have some special programs for those who are Holocaust survivors and their families. We do cooperate with Jewish Community Services out of the Associated in Baltimore for coordinating much of that kind of service. We can have grief counseling that's based in Jewish values in addition to the bereavement counseling that Gilchrist would provide for any patient. We have done some holiday programs as educational things at lots of residential centers throughout the area. They call them shalom calls. We, in our department, usually call them care calls at various times, whether that's holiday-based or just from getting to know the family. It can also be for the survivors. We would call after the Shiva, after Shloshim, just to check in and see how they and their bereavement process are going. That's pretty much the important things. We will continue serving families with bereavement services for up to 13 months after a loved one's death, up to 2 years for families of pediatric patients, and there's no cost for those supports. So let me ask you if you have particular questions about hospice care in general or Jewish hospice care in particular. Yes? It's a wonderful question. Thank you for asking it. One of the foremost authorities is Rabbi Elliot Dorff, who is the rector of the American Jewish University and written many books and articles on this kind of topic. One of the things I remember learning from him is that we should pay attention to the difference between prolonging life, which is a Jewish value, and postponing death, which is not a Jewish value. So our goal is not to postpone death, neither is it to hasten death. It's a cultural problem for us Jews who have such a strong value about life. I mean, we know we're taught that we can break any of the 613 commandments except 3 in order to save a life. And we drink l'chaim to life. So there's a huge cultural bias toward the living, but that doesn't mean that we don't respect what human beings are actually going through. We would work with the family in the case of drugs. There are some who will insist on no addictive drugs at all, and they work with the nurses and the doctors to come up with the appropriate prescriptions. The goal is to make sure that they are not in pain. And I don't have the medical background to give you the specific answers of how they manage that, but I'm confident I'm now in my 7th month of working with them, that they do a job that they get lots of kudos from families for how they handle the end-of-life issues. And that is a difficult one to juggle. I hope that answered it for you. Okay. I mean, we don't push any one kind. Again, it's the supportive stance with the family to make those kinds of decisions together. I don't think very many loved ones want their person who's on the path to death to be feeling pain or to suffer. In some ways, this is me not as Gilchrist or as a rabbi, just me as a human being, I think we treat our animals more humanely than we treat our human beings. That's a philosophical and a theological discussion that's for a different time. But that's why I think Gilchrist's approach of using the team to manage it as best as possible, knowing the family's wishes, is the right way to go. Other questions? Yes? I don't believe they do, but I know that the So I'll put my other hat on. I happen to be the volunteer president of the Jewish Federation of Howard County currently, And in our, we are still in the process of developing it, but we are revamping what we call the social support services that we're offering to the Jewish community. There are just Jewish bereavement groups available through Federation, and I would encourage you to introduce yourself to Lakeisha, who should be at the table out there. Okay. Yes. Yeah. It's a great suggestion. The best response I can give you is that the Jewish Care and Support Program actually has its own lay committee, and the gentleman who's here from Levinson Brothers happens to be the chair of that committee. Yes. So I would go to him and ask him the question, could he bring that up to the lay committee and see if they would consider having Gilchrist sponsor those, whether it's on Zoom or otherwise. Yes? I need to understand better what you're saying. I don't understand what you mean by they were kicked out after 2 sessions. By whom? Of? Yeah. Okay. I don't disagree. Again, Lakeisha would be the person to speak with about that. Okay. And it may take us a while to get that started, but she would be the appropriate place for that. Thank you all for your kind attention. You've got, I think, 5 minutes until your second breakout session, and I appreciate your choosing this one.